I want to take just a few moments to look at the public health disciplines. Public health disciplines are different areas inside public health or within public health that help support the efforts of public health. And these categories are also a way to look at different careers in public health. So I want to take just a few minutes to look at these different disciplines. And we'll start with epidemiology. So epidemiology, this is the basic science of public health. Epidemiologists are often described as disease detectives. The study of epidemics is something that they look at. They focus on human populations, usually starting with an outbreak of a disease in a community, and then they look for common exposures in an attempt to seek the causal factors, what caused whatever the epidemic is. So an example for you would be COVID-19. When that outbreak started, they noticed an increased number of cases of this viral infection, and they tried to figure out where it started and what the cause was. So they look at new diseases, they look at old diseases, they look at well understood diseases and some not so well understood diseases. And they are the mainstay of local public health departments. They undergo or they perform what we call shoe leather epidemiology. They look within our communities to find differences in data that would indicate an outbreak and then try to determine the cause of that outbreak. Statistics is a branch of applied mathematics, and with statistics, you collect data, you analyze the data, and then you try to come to conclusions from that quantitative data that can be generalized. So in public health, we have government agencies oftentimes collecting health data on the population. And these numbers are a diagnostic tool for the health of the community. The science of statistics is used to calculate risks and benefits for different interventions, and we found that with COVID-19. Statistical analysis is an integral part of any epidemiological study that is looking to find the cause of a disease. And they're an integral part of any clinical study testing the effectiveness of a new drug. So if you enjoy statistics, there's definitely a place for you in public health. The next one I want to look at is biomedical sciences. So we know that microorganisms are responsible for a major portion of human diseases. COVID-19 was caused by a microorganism. The control of these infectious diseases was a major public health focus in the 19th and early 20th century. In our next module, we'll talk more about this. But biomedical research remains important to understanding and controlling new diseases and non-infectious diseases. So not only does biomedical research look at infectious diseases to try to determine the pathogen and what will cause the pathogen to perish, but now we're also looking at chronic diseases like heart disease, cancer, and then also genetic predispositions for different diseases. So all of this falls under biomedical sciences. Next, we have environmental health science. So this is a classic component of public health. Much of the public health improvement in the United States in the 20th century was due to improved environmental health. Health is affected by exposures to different environmental factors, things like air quality, water quality, solid and hazardous wastes, safe food and drugs, global environmental changes. We're definitely seeing those global environmental changes as we have had the hottest summer on record this past summer. We also know that there are thousands of new chemicals that enter our environment every year, and little is known about their effect on health. So if you are interested in the environment and environmental health, this would be an area of public health for you to pursue. The next is social and behavioral sciences. Behavior is now the leading concern in terms of factors that affect people's health. And public health relies on the work of the social and behavioral sciences. So we use a lot of their theories that they have tested And a theory of health behavior is that a social environment affects people's behavior. This is an example. We will look at several other theories of health behavior later in the semester. But in terms of health behavior and the social environment, major health threats such as tobacco, poor diet, physical inactivity, and injuries are often shaped by our environments and by the behavior choices that we make. We know that certain ethnic minority groups also have an increased risk for a variety of health problems, and that is a combination of the social environment and the effects that it has on people's choices and people's behaviors. So, for example, if the only option you really have in your local community for dinner are fast food restaurants, there's a high probability that you will eat at fast food restaurants. That's particularly compounded if there are no good grocery stores in your area. And this is what we find in certain poor neighborhoods in Los Angeles, where they don't have grocery stores, but they have a large number of fast food chains. So those living in that area are impacted by that environment as it shapes their behavior. And we'll look at this more in the middle of the semester. And then we have health policy and management and also health administration. And this is an area of study that examines the role of medical care in public health. So we know that the cost of medical care in the United States is completely out of control. Part of that is the for-profit status of drug companies. And the rationale for that is they need to recoup the cost of their research and design. But if you look at medicines in other countries, they are much cheaper than they are here. We have a high percentage of population without health insurance, and these people will lack access to medical care. I will let you know that it is less expensive to keep people healthy than it is to let them get sick and then treat them for a lifetime. So people having lack of access to medical care actually costs us as a society more than providing them access to medical care. And the quality of medical care can be measured and is often questionable. So sometimes, many times, medical facilities are understaffed, the workers are overworked, and sometimes that can lead to questionable or less than optimal care. And medical care has eaten up profits that could be used for more beneficial things like prevention, education, housing, and the environment. So these are different disciplines within public health. There's a video I want you to watch now in terms of careers in public health, and later on in the semester we'll have a larger assignment for you to do related to careers in public health.